Welcome to the Fort Johnson podcast. I'm Jeff England. Breastfeeding is a natural form of infant nutrition that provides numerous physical and emotional benefits for both mother and child. It's an important bonding experience that helps deepen the connection between them. Here at Fort Johnson, we want to provide you with information on what breastfeeding is, how you can get started, and how it can help you successfully bond with your little one. Stay tuned to learn more about the wonderful world of breastfeeding. Here we go. Good morning, good afternoon, good evening, whenever you are listening to this podcast. I am Jeff England from the Fort Johnson Public Affairs Office. I'm still trying to get used to that. I answered the phone the other day. That was incorrectly, but they knew where I was. Anyway, today I've got with me Allison Harrison, a TRICARE network provider. Good morning, Allison. How are you doing?
I'm doing good. How are you?
Oh, I'm Peach Keen Jelly Bean. And we got Captain Cody Humple. He's a pediatrician, the OIC at the PCMH over at BJAC. Any more initialisms or acronyms I could throw in there?
Unfortunately, probably, but we're good with those.
Yeah. Okay, let's get some things straight. The OIC is an officer in charge, and the PCMH is...
The patient-centered medical home.
Yeah, she says it best.
Thanks, Gene. I haven't even introduced you yet.
I know, but I was afraid he was going to get stuck with the, what did we say it earlier?
I said primary care first. You'd think I'd know how to say my own clinic's name.
And then we've got Gene Graves, the public affairs officer at the Bain Jones Army Community Hospital, also known as BJAC, but everyone around here already knows BJAC.
Roger that.
It's kind of like JRTC. Everyone knows it stands for...
Bain Jones Army Community Hospital.
No, JRTC stands for Joint Readiness Training Center.
Roger that. From
the Joint Readiness Training Center and Fort Johnson, this is a Fort Johnson podcast. We used to do polk minutes, and they would like 1 minute spots on the radio, and we would start it off and end it with that. But anyway, I am so glad you guys are here. Thank you for showing up. It's always nice when my guests actually come here. I feel lonely when they don't. So, what's going on? Why is this? Why is it all of a sudden special and important about breastfeeding?
So, we want to come out and highlight a few things. August is National Breastfeeding Awareness Month, and this year we are hosting the inaugural, the first ever breastfeeding awareness community event on 5 August.
Thank you for not calling it the first annual.
I know, right? I learned that. I'm a public affairs guy. I know that that's inappropriate. But yeah, we'll be hosting it right outside entrance A at BJAC from 8 a.m. to noon on 5 August.
And that's the upstairs one?
No, that's the downstairs one. The staff duty. You shouldn't be able to miss it because there'll be a bounce house out there.
Ooh.
So this is going to be a whole fun for the family, educational, information, resource event for anybody who wants to come. So I'll let these guys talk to you a little bit more about breastfeeding and how important it is and what resources are available to our community. And then if they leave anything out at the end, I'll pop back in and let them know who else will be at this event on the 5th. But it's going to be amazing. It's going to be awesome. And we're really excited that we're able to host it this year.
That sounds great. You know what we don't have enough of? Balloon animals.
I was going to say bounce houses, but...
Well, bounce house, you can never have enough of those, but we do get them at at a lot of our activities.
We do not have enough balloon animals, I agree. However, there will be face painting at this event. So let's say you're a young parent and you have an infant and you're interested in learning more about breastfeeding and resources in the area, but you have a toddler. Bring them over, bring your spouse, bring the older kids. There'll be fun and stuff for everybody. And then they'll also be doing seatbelt
safety checks.
Car seat checks.
Yes, car seat checks. There'll be lots of resources from the community. Their WIC will be there. Family advocacy will be there. I guess since I'm talking about it, there'll be door prizes, face painting, car seat checks, and much, much more. So I'll let them talk to you guys about why breastfeeding is important, why it's important to have this national day of recognition or month of recognition, why we're doing what we're doing, how they can support you, and then I'll figure out what else is going to be happening on the 5th and fill that in at the end.
And be sure to like us on Facebook, and that way you can keep up to date on all of the special events that are going on.
Yep, and we have a Facebook page as well, and this event is out there, so people can actually click on the event, and it'll remind them when the event happens. So they don't have to constantly be on Facebook.
Ah, gotcha. But I'm constantly on Facebook anyway. So, I mean, who isn't? Well, I guess it's just the old people.
I'm not going to comment.
Captain over here is on Snapchat. So, Allison, what's going on over at your special place of duty?
So I just recently got accepted to be in network for TRICARE as a lactation counselor.
Nice.
And that means that any either expecting parent or new parent who's having any trouble with breastfeeding or pumping or anything related to lactation, they don't even need a referral from their physician anymore. They can contact me directly, or they can just ask their physician and they can put in that referral, but they can get support up to 27 weeks pregnancy, so they can kind of figure out what's going on in advance, which we know is super effective to building a good breastfeeding relationship. And then afterwards, we're available to help.
Now, why would it be? I mean, when I grew up, it was formula, and then we have this formula shortage. But people used to make formula before formula was there.
Sure. Well, the homemade formulas that people did make definitely did not contain the proper nutrients, fat to calorie ratios, anything like that. And I mean, since the beginning of humanity, breastfeeding has existed. It lost its place in society for several decades, which unfortunately makes it extra difficult for new moms to breastfeed. They didn't grow up seeing it regularly. They don't know what it looks like. They don't know what to expect with their own body. So we're trying to kind of get the pendulum to swing back, but these new moms now are definitely needing more support than maybe 100 years ago, because those women were birthing with community already there. And our military spouses specifically don't have that community always to get the help from. So we are trying to help fill that void and help them get support, and also to learn the benefits of breastfeeding, because it is, for the vast majority of infants and moms, the healthiest route. Healthy for the baby, healthy for the mom, and can provide antibodies that are not ever going to be available in formula. And that can help protect the infant from illness, and it lowers a mom's risk of cancer and heart disease and diabetes. And we know that it protects the infant against lots of diseases, and also helps to prevent future obesity.
Really?
Yep.
So that's why I'm fat.
Yep.
It was the formula.
It was the formula. So as a pediatrician, imagine that's what you are, as a
That's me.
pediatrician.
Yes, that's the top title.
Top title. You're the OIC pediatrician. That's pretty impressive as a captain. You're in charge of all of the children.
Unfortunately. But it's good. We're having a good time over there.
So I would imagine that it's pretty hard to be a pediatrician. I liken it to being a veterinarian, because baby can't tell you exactly what's going on, what's wrong, so you have to figure it out.
It is sometimes a mystery.
Yeah.
Babies cannot tell you why their tummy hurts, but we make do.
It's like, sorry, doctor, I have acid reflux.
Yes.
It's been a very special, pressurized day. I'm stressed out. These blocks won't line up. I can't spell cat.
They don't make it easy for us, but it's very rewarding, though.
So why don't you take us through a day in the life of a pediatrician? You come in, you make coffee, you go on a podcast.
Yeah, today's been a little. This is the normal.
Actually, I believe you've been working a lot, and you're probably on call right now.
I am currently working. I've only been at the hospital, like 20 hours in the last 36. So not
that's
that
it.
bad.
Oh, that's it. Come on.
Regular
Easy.
day.
Well, when you're in the Army, you're on duty 24/7, right? Yeah.
Exactly.
So, do you see any when children? Do you see a difference in children's health between breastfeeding and not?
So, in theory, we would. The Army does make it a little bit difficult for us to kind of follow our patients over a long term, right? So say I do see a baby when they're born and I get assigned to them, I follow with them over 3 years at the maximum, right? Then their parents are getting moved off, or I'm getting moved off to somewhere else. But
That does make it difficult.
It makes it a little bit hard to see those long-term effects, like, preventing obesity, things like that. But the things that I don't keep track of the numbers, but it is fairly kind of obvious sometimes that we have had a pretty big decrease in our respiratory infections, right? As breastfeeding is definitely becoming more common than it was. And that does help with the antibodies that are transferred from mom. And there's plenty of other benefits just to families in general that I see more than really the health side of things, just because I can't follow people for very long.
Now, there's a old wives' tale or whatever it is, but if you eat local honey, that'll help with allergies and stuff from local areas. Are you seeing the same thing with breastfeeding? Does that do you think, or within all of your studies and research and all that stuff, do you see any benefits like that?
So it is a similar thing, right? So your mom, when you were born, has had many, many years to build up antibodies to the common cold, things like that. And so as you are a brand new baby, you aren't set up with any of that, right? You got to start from scratch. But if you breastfeed, she can donate those to you to give you a better advantage. So,
well, it's better than loaning.
Yes.
I'd hate to have to give them back.
You don't have to give them back.
No, they're donated.
Yes, donated.
Yes. So are there, do you recommend a specific diet for lactating mothers?
Nope. The biggest thing that I recommend is hydrate, right? You are
Makes sense.
getting a lot of fluid out, and it's summer.
And you will
it's
be thirsty.
Louisiana. Yeah.
You will be thirsty.
Your body tends to compensate, but you definitely need to drink a lot to maintain that. The only times that I say maybe play with your diet a little bit is some infants do have trouble digesting certain things, right? So some infants can't tolerate lactose, things in milk, right? And so sometimes if mom's really willing to switch it up, we can make some of those changes. But for the most part, there's really no reason.
Oh, that'd be horrible.
It'd be very sad.
I've got a lactose intolerant child, but I'm breastfeeding.
So you got to avoid cheese and milk and
it's not
the creamer. So mom has to avoid it.
It's cow lactose.
Yes, cow lactose. So
Gotcha.
mom's milk is totally fine.
From what I hear, I've heard a lot saying that, after a certain age, you're not supposed to even worry about drinking milk. And, I was told I have to drink milk all growing up. It was milk with dinner and milk with breakfast and milk this and milk that. And
As a representative of the dairy state, I agree.
now, don't get me going on cheese. I'll eat cheese all day and night. So are there classes? I mean, you're offering help.
So as of now, we have one-on-one in-person classes that can be done at the hospital itself or in the parent's home. I do in-home visits. We are working towards having dedicated breastfeeding classes specific at BJAC. There are classes you can take while you're pregnant, and there's a little itty-bitty portion about breastfeeding, but it's certainly not enough for someone who really is wanting to make this commitment to know what to expect, what to have in their wheelhouse of knowledge so that when something goes awry at 2 a.m. and they don't have access to, a provider immediately, they kind of can remember what was already taught to them. So we are working on getting that done. But in the meantime, we can definitely still do one-on-one.
What would you say is the biggest problem that you're seeing with new mothers?
It's usually a fear of lack of supply, and it almost never really is a lack of supply issue. So formula-fed babies are usually given 2 to 4 ounces of formula right out the gate from the time they're born. And unfortunately, that's really too much for their belly. Their belly is like the size of a marble when they're born. And so new moms who may not have had their mature milk come in yet, because it can take up to a week, sometimes even 10 to 14 days, they think, oh my goodness, I am not making enough milk. My baby wants to eat all the time. Well, that's actually the biological norm. That's what newborns are supposed to do. It can help prevent SIDS. It keeps them close to the baby. It helps build a future milk supply. The more they nurse in the beginning, the more likely that milk will come in fully, and they will be able to establish
Did you know that's the same with cows?
I mean, it makes sense.
Yeah.
Lactation's lactation.
Yeah, it's crazy.
So yeah, I mean, it's just getting rid of that fear because again, we were a society that wasn't used to seeing this in place for decades. So new moms don't know what it looks like to have a newborn feeding. And they just assume that the baby's going to be eating every 3 to 4 hours and take this perfect amount of milk. And when you are breastfeeding, you can't really see how much milk the baby's taking. So we like to teach them cues of what looks like hunger, what isn't hunger, what we can do to help alleviate those fears, because that is literally the number one reason women quit breastfeeding in the first 6 weeks is they think they don't have enough milk when in fact they do. And unfortunately, it's a slippery slope. So the moment they start supplementing with formula out of fear, that tells their body, oh, I don't need to make that extra milk. And then little by little, you really do decrease your milk supply inadvertently. So by giving them information in advance, they can learn to know what is a happy fed baby and what is not, and make the difference so that they can make good decisions from the go.
Now, something that's always bothered me, and I'm sure, well, it's because I'm just weird like that. What is the natural age that you should quit?
It really will depend on child and parent. I like to remind my parents that they have a say-so in this. If you are no longer comfortable breastfeeding at 6 months, that is okay for you. Now, your infant will need formula up to a year old because breast milk or formula should be the primary source of calories. But
So it's about a year old.
well, so now the AAP, which is the American Academy of Pediatrics, actually recommends up to age 2 and beyond. Mm-hmm. There are benefits to breast milk. The calorie content, the protein content, and the fat content will change in breast milk as the child ages. In societies where breastfeeding is more accepted, you see a natural weaning age of between 3 to 5 plus. At that point, it's not all day, every day. Usually it's every now and then, but there are still antibodies present in that milk up until the last drop. So we see now that it used to be called extended breastfeeding, but it really should be called just natural breastfeeding or term breastfeeding, because children who are allowed to nurse whenever they want and parents that are comfortable with that rarely will wean before their second birthday.
So if they're driving home from college, it's just
I have yet to see someone
it's a little
nurse
too
that
late.
long.
Yeah.
But there's still antibodies there. I mean, they've done studies that breast milk can shrink the size of tumors of adults. So there's always going to be a benefit. Now, again, most people don't want to nurse their 16-year-old, but
No.
That's again when parent say has, a play.
Yeah. There's been a couple of movies where the joke is the kid's like 6 or 7 years old. It's like, hey, mom.
But in other countries, that's very, very common. Only in America have we demonized nursing past the age of 1.
Demonized.
I mean, they're vilified sometimes. I mean, like they're the butt of jokes. I mean,
They are,
That's
just
true.
like me.
but
Wait a minute. So this, what is this, event that's going on? When is this going to happen?
So the event is going to happen on August 5th. It's a Saturday.
August 5th, and that's coming up really quick.
It is coming up really quick, and we hope to get as much involvement with the community as possible. It's going to be kind of I would say like an information type fair. You can pop in anytime between 8 and noon. There'll be door prizes that'll be given out every hour on the hour, and raffle tickets. I think they've got some breast pumps and some other great stuff for new parents. We have some representatives from the WIC office that'll be there. We've got new parent support program. We've got the pregnancy and postpartum P3T, I don't know what that stands for, but Sergeant First Class Doris is the NCOIC of it. And it's for our active duty moms who are pregnant and postpartum, their PT program. The new Life Center will be there. We'll have behavioral health there because sometimes there's some postpartum issues that mothers experience. I know I did.
Yeah,
when
we hear a lot about the postpartum depression. kind
sure,
of
and
thing.
postpartum anxiety too. I mean, they're both very real. So.
Yeah. And I think it'll be great to have that there and just kind of let the community know that it's normal and that there's help there for them. Family advocacy from Army Community Service will be there. We have our lactation counselor, Allison, will be there. And then several of our nurses are taking the lactation.
CLC, so the Certified Lactation Counselor. It's one of a handful of different lactation credentials you can hold, but it does seem to have a little more weight in our society. So,
And I think it'll be nice having some nurses on the floor that are certified. So immediately after a child's birth, they can kind of help mom with latching. So they'll be there. A couple breast pump vendors will be there. MWR is going to be supplying the bounce house. And we have car seat technicians, and there'll also be food trucks, coffee truck. So it'll be kind of like a fun little festival vibe with face painting, bounce houses for the kids, and information.
yeah.
I think it'll be great. I know we talked about the long-term effects of breastfeeding your children. My son was breastfed, and he's a United States Marine right now. So that'll just tell you right there.
It works.
It works. It works. He's strong. He's healthy. Never was sick.
Okay.
But
so,
it's important to me. So when I first met Allison, she wanted to offer her services. And so we were able to get her connected originally through the Red Cross to volunteer, and has helped countless patients at BJAC as a volunteer while she finalized her licensure and
the paperwork.
The paperwork with TRICARE. And so we did an event back in April. It was called the Big Latch, and that was part of the global Mom to Mom initiative. And that was awesome. We had probably about 30 people there.
Yeah.
So we're hoping that the momentum is there. Everyone there had a great time, and maybe we'll get 100 at this event. That would be amazing.
We really just want to normalize breastfeeding. I mean, make it so that we go back to how it was, where it's just what is common and seen, and people don't think it's weird or unnormal, so that, you feel supported. The more it's normalized, the more you feel supported.
I think that's why they do a lot of these national recognition months in general, is just to provide information and education about it. Someone may not even know that this is something they want to do until they come to an event like this and learn more about it and see that there is support available to them. And I like the fact that TRICARE does offer these services to family members. I don't think they did when I was coming up. And
No, this initiative is, I think, about 2 years old, where you can get some support
pretty new.
and actually get it covered and get it by a trained professional.
Trained professional.
And there's no referral necessary.
Correct. For in-network. So now that I am an in-network provider, patients don't have to have a referral. Now their physician can still set them up with one if they're unsure of who to contact. There are several virtual options out there, but for now, I am the only one within a 2-hour radius that can see people in person.
Well, you're going to be busy.
Yeah. Well, yeah.
So I'm stuck on that event back in April.
Yeah.
Yes.
The latch event.
The big latch on.
Oh, the big latch gives a whole new meaning to the latchkey kid.
Kind of. It was kind of cool. Like Allison brought it up. Dr. Humphrey was there, and we had several doctors and nurses there, along with New Parent Support Program. And it was just like this initiative that's been going on for several years. I think it started in Kaiserslautern, Germany, was the original one. And it's just to get as many people to latch on during a certain time frame around the world. So we were the only one in Louisiana, weren't we?
We were the only one in the state of Louisiana, which is pretty remarkable because statistically, rural communities have much less breastfeeding rates than their urban and suburban counterparts.
Really?
So there was not an event in New Orleans. There was not an event in Baton Rouge, but there was one here at then Fort Polk, now Fort
You
Johnson.
would think that would be the opposite.
So I actually got to speak at the Appalachian Breastfeeding Network on that, and how in rural communities it used to be the most common, but then unfortunately, accidentally through the introduction of WIC, it kind of became more common to use formula because WIC does have that availability to them. And now WIC has done a great job of recognizing that, and hopefully the pendulum swings again and we get back to breastfeeding being commonplace everywhere, not just in urban areas.
Gotcha. I gotcha.
I would also like to say,
No, you can't say it. Sorry.
we talked a lot about
No, go ahead, say it.
breastfeeding.
No, go
right?
ahead, say it.
I'm working on it. But there are times when you can't, right? So say you are an active duty soldier. There are some things put together to help promote it, but there are situations where you can't do it. Like it is not going to work. Either there was some medical reason or a social reason, something like that. And this event is not just for those of the folks that have managed to, oh yeah, you were able to breastfeed, cool, you can show up.
Sure.
Everybody else, nah, you failed your baby. But no, the biggest thing is we want you to feed your babies, right? That is the big thing. If you can't breastfeed, I'm supporting you with every other option we got, right? And so at the event, right, we have people from WIC, we have people with FAP, all this other stuff that is not just breastfeeding like aimed. And so for any families out here, definitely show up, because though this is like, yeah, we are supporting breastfeeding, trying to get that going, we do recognize there are times where it just does not work.
Right. And I mean, and that's one of the things too, like when we talked about the formula fed babies getting these big bottles of formula, well, that shouldn't be happening even for them, you know? And if, as a lactation counselor, I can teach you how to feed your baby from a bottle appropriately too, to help with that obesity potential link. And there are other things that, you know, lactation counselors, though lactation's in our name, we really can't help with infant feeding in general, how to start solids, what is the age appropriate time to start solids, how to introduce them. Are you going to use purees or a baby-led, you know, more solid food introduction? So those are all things that we can do, and we are happy to help everyone. It doesn't matter. We don't think that one is better than the other.
Now, when you feed, everything that I've seen, you know, when you feed a baby and it spits up, is breastfeeding, you're going to be less likely to spit up, or?
So I think that that's a common myth. I know personally that that is not always the case. You do get women with oversupply and overactive letdown. And so they then think all of a sudden their baby has reflux. Well, really, it's some things that we can manage with proper care. Usually, most women do tend to produce less spit-uppy babies simply because breast milk usually comes from the breast slower than it would from a bottle.
And less
but
air.
Not always. And yeah, it's a vacuum-sealed container.
I've got so many things running through my head right now that I have to censor myself or my boss will get mad.
Good.
So what happens when the baby starts teething?
So it is something that a lot of parents will come to me and say, hey, you know, my baby bit me. What can I do?
Ow, Charlie bit me.
When they teeth really early, it is hard. And it's something that we can learn to show the mom how to look, because baby will change their latch right before they bite. They cannot physically bite while latched properly. So you can be very mindful and then just put your finger there to help prevent it. And it really does work. Now, once baby's like 9 or 10 months old, they have the cognitive ability to understand cause and effect.
Yes.
And so they can be removed from the breast immediately if they bite. And it usually only takes 1 or 2 times. And they're like, I don't like not getting what I want.
Yep.
And they stop.
That's how my wife did it. Her kid bit down and she goes, nope, that's
Yep.
it.
And I mean, and usually
it only happened once.
it's the babies that cut teeth at like 3 months old that I'm like, oh, let's work through this together, Mom, because I know it hurts. And I'm not going to be the person that just says, just grin and bear and get over it, because that's not practical advice. But yeah, I mean, when they're 7, 8, 9 months old, it tends to be a lot easier to help fix that.
I think the thing about this event that's coming up and that the doc hinted on is it really is just a family health fair. The focus is in line with our Breastfeeding Awareness Month. And so we do have a lot of breastfeeding awareness activities, but it is really just for overall health for you and your family. There'll be so much information there. All of the practitioners that we have at the hospital, all of our nurses, all of our docs, everybody truly cares very deeply about our community and their health. And this is something that's kind of bubbled up as something that people want. They want to learn about the child safety seat
Absolutely.
Stuff. These are things that have come up, and that's why we've kind of put them all together to this one event. And hopefully it'll be successful in a way that we can do it more often, because sometimes, especially young families, this is the time of year where a lot of new people are moving to the area. They may not know what the resources are. There's a lot of negative talk about installations when you move from place to place that aren't necessarily founded in any facts. And so we want to just give people an opportunity to come to BJAC, meet some of our people, and meet some of our community support systems, because that's going to help them ultimately as they spend their time here.
That is one of the best things about going to any of these activities is you get out there and you get to meet other people, and you automatically have something in common with them.
Yeah.
Just based off that you're at the same activity.
I mean, and to meet other, like as a stay-at-home parent myself for several years, it's sometimes difficult to meet
You need to get out.
people. I know, right? And so these events can help new moms, maybe just PCS'd here. They don't know anyone. Maybe their neighbors aren't very friendly, so they're having a hard time meeting somebody. You're immediately going to meet people with the kids the same age as your kids, and it helps mental health there too, even in not any sort of formal training, but just having friends and having a place where you can go meet people is very helpful to all new moms.
Of course.
I think sometimes people come to BJAC, their first time is they're not feeling well. They don't feel well. Their child doesn't feel well. Their anxiety's high. You know what I mean?
When I go to the doctor.
Emotions are high. So you come in and it's like your experience is based on that moment in time. So coming in when you're feeling great on a beautiful Saturday afternoon, get some coffee, let the kids get a face paint, learn some information, meet some other people. It's really a great initiative. And I just got to do a shout out to Specialist Sydney Pierce. She is an LPN active duty soldier at BJAC, and she has taken the ball and run with it. She's had some help from Lori and Amanda from OBGYN and LDRP as well. But really, this has been her brainchild. And part of what motivated her to do it was she PCS'd here last year, 8 months pregnant, knew no one, knew of no resources. Now she's a nurse, but she was on, what is paternity leave now, or maternity leave, 12 weeks. So she was here alone with a newborn, and she didn't want anyone else to have to feel that way. And so she wanted to do something for the community, and I wish she could have been here today.
Yeah, but she didn't want to show up today. I see how.
Well, I think she worked last night, and
so did Cody.
that's true. That's true.
But she also has a little baby at home.
Yes, I don't have a baby to take care of.
Yet.
24/7 working.
24/7. Yeah, being a parent is just well, I don't know if I'd say I'm lucky or not, but either way, I've never had to go through the whole newborn experience and, waking up all hours of the night and having to feed 15 times a day and change poopy diapers. And
it can be overwhelming. And I think that that's part of why this event is really important. And when I came to this installation almost 4 years ago, there were very few resources available for breastfeeding moms, and that didn't set well with me either. And I was like, what can we do? And I found out about the Global Military Lactation Community, which is a global nonprofit helping both active duty and spouses that are breastfeeding, and links them into not only what laws protect them, depending on their branch of service, but also what does TRICARE cover? What are you allowed to get? Are you allowed to get a pump? Are you allowed to get,
From what I hear, they'll have some pumps over at the event.
They will, which is always great because, even if you have one, you might need a second one for something. And it was just a great way, and it's grown since then. I started up the organization here at Fort Johnson, and then now we've got more things at BJAC available, and it really has become night and day difference as to what we had available 4 years ago to what we have today, and I hope it continues to.
Yeah, I imagine that the big difference just from more acceptance and the more it's out there in front of you.
Absolutely. Yeah, and that's just what it's really about. Like, the more people see it, the more they will accept it and be understanding and just truly knowledgeable to learn that these women are making the commitment for a reason, and that we should applaud them and support them and not shun them or make them feel weird. And then just how to support them, like with the active duty that, Captain talked about, like, we do have laws in place to support. And what does that look like if an active duty soldier comes in and is like, I'm not being allowed to pump? Okay, well, let's get you, the policies to show your commander so that they do know, because sometimes commanders don't know what is allowed. And, it's just a constant conversation and trying to point people in the right direction and having resources easily and readily available, I think, is the issue, because those resources have always been there, but they're not always easy to find.
Yeah.
Yes.
Yeah. I don't know why they wouldn't be allowed to, that's just, to me, that's just weird because
being unfamiliar, right?
Yeah.
Right.
So you've always been in charge of a bunch of male soldiers.
Sure.
And, you've got a couple women that have babies that are trying to breastfeed.
Sure.
You just never had to deal with it. So most commanders, when you present them like, hey, this is what needs to be done, there's rarely any kickback. We just need to inform them.
Right. And and it's constantly changing too,
Exactly.
because there are some women in the service that have worked their way up and now have a voice that can be heard. And they're doing some pretty amazing things. They're trying to get it so that if you are sent TDY for some reason and you need to pump while you're gone, that the military can now reimburse you to have your milk shipped back to your baby. And that's like breaking legislation. And it's just constantly changing. So it is hard for commanders to stay up to date as to what is accurate.
That's pretty awesome to hear about, like if you're deployed or something.
Yeah, and I mean,
or even TDY.
Right. I mean, and it's going to be constantly changing. And as we learn more, and I hope one day that there's a place at JRTC for, us to hold milk so that when they leave, they can take it with them or it can be shipped. I mean, and it's growing and we understand that, and it's not always going to be perfect in the moment, but just trying to constantly strive to allow our active duty soldiers that are breastfeeding all the opportunities that their civilian counterparts would have.
So now now when somebody is breastfeeding, or what foods and liquids should they avoid?
You would not want to drink in excess.
I would imagine smoking and drinking alcohol is.
Though there are some really cool studies about smoking. Not that I would advocate for smoking and breastfeeding, but there are actually lower levels of some chemicals in breast milk from a woman who has smoked than there are in the actual formula. And I mean, we're talking heavy metals, so. They
don't smoke around your baby.
No, definitely not. Definitely not. But they did, they used to think
roll
that...
all the windows up while you're driving down the street.
They used to think that formula was the safer thing, but when we've done studies, we found that actually there are less heavy metals still in the mother's milk.
The formula
than in
is not
but
perfect.
There's higher amounts of tar and nicotine.
I mean, not in the milk itself.
Well, maybe.
On the mother's skin.
You can't prove that.
But yeah, I mean, in the most part, use some common sense. If you are intoxicated, that means that there is alcohol in your milk.
Yep.
Is it at a high enough concentration to do anything? It would be really hard to tell, but, err on the side of caution. Once you feel sober, you may continue to nurse. You do not need to pump and dump, which was an old theory, because alcohol is metabolized as quickly in the milk as it is in the blood. So if you feel good.
I did not know that.
Yeah. So, and actually most grape juice contains more alcohol than that breast milk probably does.
Only after fermentation.
Well, even actually before fermentation.
That's called wine.
But yeah, I mean, eat what you want. Eat garlic, eat spicy foods, eat tomatoes, eat citrus, all the things that I've heard.
Pineapple.
The vast majority of them are not
Eat
true.
whatever. If you are on medications, we have plenty of doctors at the hospital that you will be seeing. Just ask.
Yeah.
Most of the time, your OB providers are already screening that and will let you know before your baby's even born.
Sure. And and that's something too, and BJAC's ER department has really tried to grow their knowledge of what they can prescribe and what they can't. And the vast majority of it is safe. So if as a patient, you get advice that doesn't sound right to you, reach out for a second opinion. It's okay. There are databases available to let providers know the risk level associated, but for most of the time, the risk is very minimal and the benefit outweighs it.
Gotcha. And and don't feed a little baby under 1 year old honey.
Correct.
Yes.
Because it contains botulism.
Yeah.
Small amounts, but we can afford it, but they can't.
Correct.
So be safe, be healthy. Come out to the
Breastfeeding Awareness Community Event on August 5th from 8 a.m. to noon at Bain Jones Army Community Hospital.
We're going to have to work on the title there.
I know I didn't name it, but I think it's okay. I think we're calling it the Breastfeeding Awareness Month Community Event because it is August Breastfeeding Awareness Month.
BFAM.
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 Come to the BFAM.
Come at Fort Johnson, your family. So come to BFAM.
I kind of like that.
Yeah, you like
that could be the new hashtag.
Yeah, there it is.
BFAM at Johnson.
BFAM at Johnson. Well, I appreciate everybody coming in today. Thanks a lot, Allison. It was great for you to come on down and
thanks for having me.
Get past all that road constructions and trains and traffic signals and,
rural
and stuff.
Louisiana.
And Captain Humple, thanks for taking time out of your busy day and showing up at the public affairs office just for me. That's great.
No problem.
And Gene, it's always nice to see you come in here every so often.
Nice to see you, Jeff.
It's
I need to come in more often so
you
we get
do.
more podcast time.
You should. I've been trying to get Reagan.
Yeah, we need to get
Yeah,
him.
yeah.
Suicide Prevention Month, September.
He's so busy.
It is a busy hospital over there, so we got everyone working hard, and and we're expanding everything out here. But that's about all we have time for today on the Fort Johnson podcast. Until next time, I'm Jeff England from the Fort Johnson Public Affairs Office. So take care and happy feeding. Bye now.